Is chronic pancreatitis a risk for pancreatic cancer? Chronic pancreatitis is a long-lasting inflammation of the pancreas that can cause ongoing damage to this vital organ. Research shows that having chronic pancreatitis significantly increases the risk of developing pancreatic cancer, especially the most common type, called pancreatic ductal adenocarcinoma. Studies consistently find that people with chronic pancreatitis are about 10 to 16 times more likely to develop pancreatic cancer compared to those without the condition. The risk tends to grow with the length of time someone has had chronic pancreatitis. For example, in cases of alcohol-related chronic pancreatitis, the chance of developing pancreatic cancer after 15 to 20 years can be around 4%. If someone has hereditary pancreatitis, which is caused by specific genetic mutations like PRSS1 or SPINK1, the risk can be even higher, reaching nearly 20% in some cases. Age also plays a role. Older individuals diagnosed with chronic pancreatitis, especially those over 60, tend to have a higher chance of developing pancreatic cancer. Interestingly, many pancreatic cancers are diagnosed within 3 to 5 years after a person is diagnosed with chronic pancreatitis. This could mean that the inflammation from pancreatitis might sometimes be an early sign or even a precursor to cancer development. The link between chronic pancreatitis and pancreatic cancer involves complex biological processes. Chronic inflammation causes repeated injury and repair in the pancreas, which can lead to genetic mutations in key genes like CRAS and TP53. These mutations can promote cancer growth. Smoking is another important factor that can increase the risk for people with chronic pancreatitis, as tobacco use is known to damage pancreatic tissue and promote cancer development. Diagnosing pancreatic cancer in someone with chronic pancreatitis can be tricky because the symptoms and imaging results often overlap. That's why close monitoring and regular screening are important, especially for those with hereditary pancreatitis or long-standing disease. Advanced diagnostic tools, such as endoscopic ultrasound-guided biopsies and molecular testing, can help detect cancer early when treatment options are more effective. While chronic pancreatitis does increase the risk of pancreatic cancer, it's important to remember that most pancreatic cancers occur in people without a history of pancreatitis. The overall contribution of chronic pancreatitis to all pancreatic cancer cases is estimated to be between 2 and 7%. In summary, chronic pancreatitis is an important risk factor for pancreatic cancer, especially in cases of long duration, older age, hereditary forms, or when combined with smoking. Maintaining pancreas health through lifestyle changes like quitting smoking and reducing alcohol intake, along with regular medical follow-up, can help catch potential problems early. If you have chronic pancreatitis, talking with your healthcare provider about appropriate screening and risk management strategies is a key step toward better health outcomes.